Here at Blakely, Manchester, are the laboratories in which the discovery of antrycide has been made. And most people will have learned from the reports in the press and the BBC of the announcement by the Under-Secretary of the Colonies, Mr. D.R. Rees-Williams, the significance of this discovery so far as tropical Africa is concerned. And the map gives a ready indication of the enormous area of the continent of Africa which is ravaged by the disease in cattle called trypanosomiasis, for which antrycide is a cure, and which we are hopeful will also confer for a period immunity against further attacks. The investigations during the last 18 months of this drug in the field in Africa by our research people has been made possible by the active cooperation of the Colonial Office, especially the members of the Tsetse Fly Committee and its veterinary staff in tropical Africa. This laborious and detailed work in the field was made necessary because it was too risky to infect large-scale animals like the cow in this country. You will see here today the laboratories and the kind of work which is carried out in an investigation of this kind, leading to the great discovery and eventually to the progress of manufacture on a large scale. I would like to speak for a moment on what I think is an essential background to lead to discoveries of this kind. We have here about 300 organic chemists engaged in research work on various fields of organic chemistry, and a team of this magnitude can obviously not be built up overnight. From small beginnings, more than a generation ago, in one of the older laboratories, which you will see, and with synthetic dyestuffs as a basis, we have grown to the existing building you now see occupied, and the one in the course of erection. Even these early years were concerned with research work in organic chemistry, not only in the field of dyestuffs, but in many other directions as well, such as chemicals for the rubber industry, and latterly the enormous field of synthetic fibers for textiles. Some 10 years ago, we began to be interested in the field of synthetic organic medicinals. We created a biological department staffed with the necessary biological and medical workers, and it is obvious that none of this could have been properly built up but for the faith and the necessary expenditure of money which has always been forthcoming from Lord McGowan and the Board of ICI. And here I would particularly like to single out Dr. Cronshaw, whose life work can be said to have been engaged in building up this effort. Our first great discovery was paludrin for the treatment of malaria in 1945. And it is an interesting reflection at this point to recall that the first synthetic organic dyestuff was discovered by chance by Sir William Perkin, an English chemist, in 1856, when he was in search of a process for making quinine, the oldest effective drug for the treatment of malaria. All this, I think, serves to convey the enormous potential influence of the science of organic chemistry for the welfare and the betterment of man. And I would like to say that in the ordinary field of synthetic organic medicinal products, the happiest results are to be expected when organic chemists, biologists, and pharmacists are working together in an area, and each is learning from the other the special contribution which his skill can contribute. Our pride in this achievement is unfortunately dimmed by the death of Dr. Curd, who was the leader of the chemists on tropical disease. Dr. Davy and Dr. Scott, our biological colleagues, are still in Africa. These names are to be specially mentioned, but you must remember also the large number of my colleagues who, while playing a less spectacular part in this discovery, have nevertheless contributed their important share to the organization which has made this achievement possible.